Welcome back. I'm glad you're with me today. We'll be discussing a topic that probably most of you are unfamiliar with, and it's two different kinds of eating plans. They're not really diets, but they're called diets. One is the elimination diet, and the other is the elemental diet. They're strategies to improve digestive related problems, specific reasons for each, and we'll discuss those today. So if you've ever struggled with digestive issues, with what you suspect are food sensitivities or chronic inflammation, you may have heard about these things but are unfamiliar. So we'll discuss them in detail. There are two approaches. They can be very powerful for gut healing, for identifying food intolerances or allergies, those sorts of things, improve gut health, but they serve very different purposes. So in this lesson, we'll explore what they are, what the benefits and disadvantages, and when to use each one. So we'll take a closer look at that in this lesson. The first of these two is the elimination diet, by far more common and more familiar to most. And it's not really a diet, it's an eating plan. It's a short-term plan designed to identify food sensitivities. You systematically remove foods, particular ones, categories, classes, or types, and then reintroduce them specifically to find out what the culprit foods are. It's often used for people that experience a number of digestive or GI related symptoms, including just GI discomfort, which can be in the form of gas or bloating, diarrhea, constipation, symptoms that disrupt your daily life and make you uncomfortable. It can also be used for skin conditions related to allergy. So persistent eczema or rashes, acne, histamine release is a common one. You get those red rashes all over because you're eating something that your body's reacting to. It's connected to your system in general by gut-related inflammation and response. The next would be, migraines or joint pain, those sorts of things. It can happen as a result of allergy or allergic sensitivity to particular foods, and that is connected with an autoimmune response. And so you can get chronic inflammation as you consistently eat something that your body's reacting to. Worse, obviously, with certain food triggers. And then you can also have neurologic symptoms, chronic fatigue, brain fog, cognitive impairment, and that related to that gut-brain connection we've discussed a little bit, and we'll be talking about some more. So that's the purpose and understanding of the elimination diet. We'll go into that in more detail. So how exactly does the elimination diet work? Well, during this diet, this window that you're going to attempt to use the elimination diet, you remove certain common trigger foods, things that maybe you suspect you have difficulty with. And if not, I recommend you start with things like dairy, gluten, soy, eggs, corn, processed sugar. Those are the common ones. And you can have specific ones that you know. For example, every time I eat blank, fill in the blank, whatever it is, it bothers me. I don't feel good, etc. You can know that. For example, I went to Dunkin' Donuts and I bought a particular coffee, and every time I got that, I got severe 2-day long joint pain in my fingers, every joint knuckle in my finger. And I tried it several times to prove that's exactly it. There's something in the creamer, the material, that gave me symptomatology, just that one specific thing. Clearly, I don't drink that anymore. This was many years ago. But before I was familiar with this, I identified one thing that as a trigger. And that's really the purpose of the elimination diet. Your goal here is to identify which foods trigger inflammation, digestive issues, rashes, just system-wide or body reactions that's telling you my body does not like something in this food. It could be a lectin, it could be a anything in that food, and you can tailor your diet then long term to eliminate that particular allergen or sensitivity. So remove all the potential trigger foods. The purpose is 4 to 6 weeks to allow your body and your immune system in particular to reacting to those things, an opportunity to reset, no longer put that in front of your immune system for evaluation and reaction, and then wait until those symptoms improve or resolve, allowing that inflammation that's triggered by that to subside, and then add one food group, one specific item back in every few days and monitor for reaction or response. Sometimes you need to wait longer if you get that response. You recognize I can't have that product, and you may try that again in, say, 6 months, 9 months, and see if that's the issue. For example, if it's eggs, you eliminate eggs, I try them again a month later, I have the same reaction, then wait 6 months and try them again and see if that's different. And you may find eggs that are cooked are a little different from eggs that are, say, raw or minimally cooked. And so you can figure that out with the elimination diet. You can create a customized diet plan then to eliminate the things that are giving you triggers, causing inflammation, pain, or symptomatology. So, on to the second type that we're going to discuss, which is the elemental diet. And I hazard a guess that the majority of those listening or watching this are very unfamiliar with this, so I'll review that. It's a specific diet. It's certainly more extreme. It's designed to completely reset and rest your GI tract, your gut. It involves consuming only fully broken down essential nutrients. They're consumed in a liquid form, powder form, put into a liquid, just giving your digestive system a vacation, an opportunity not to have to function effectively to break down your food and turn it into something that you can use as nutrition. I've read and understand that about 40, more than 40% of the food calories that you consume, the nutritional value, is used in the prospect of breaking down, digesting, and using the nutrition in the food that you consume. In other words, about 40% of what you eat is broken down and used as fuel to continue the process of digestion. You think about it, you've got these large pieces of food, and your body has to break them down, break them open, get the nutritional value out, absorb that, and use that. And that process takes time, it takes energy, and it's difficult. So by giving your gut a rest, you can stop some of that. It's like the border patrol getting a rest and not having people come and line up. It gives them a chance to recover and chance to manage the day to day without being overwhelmed. So what in the world is that all about, and what can you do? What's it used for? Well, it's typically used for severe gut conditions. And I don't know if you've heard about SIBO, which is small intestinal bacterial overgrowth, very common, or SIFO, which is small intestinal fungal overgrowth. Commonly used for those two conditions and very effective. I've used it for both. And the reason for that is that if you eliminate the things that those organisms, either bacterial or fungal, like to eat, you essentially starve them. You resolve the infection problem, overgrowth of these bad bacteria or excessive fungus inside your gastrointestinal tract. You eliminate the foods that they feed on, no food, no growth. And so you improve the function in that fashion. Another is obviously inflammatory bowel disease. So if your gut is inflamed and it's really inflamed in there, why would you put more product in that will cause additional inflammation? You've got ulcerations, ulcerative colitis, for example. We remove all of those foods and the triggers that go with them and give it a chance to recover. If you've got a wound on your knee, you're not going to want to bend down and put pressure on your knee, for example. Well, that's what we do with our gut. If it's inflamed and we keep putting food in every day, it doesn't give it a chance to recover and heal. Another would be a severe food allergy or inability to absorb the food and the nutrients that you have, say post-surgery, those sorts of things. It could be a severe allergy. I try that, elimination diet, it's not really effective for me or partially effective. We may move then to the elemental diet to give you even more rest and eliminate those triggers for a while. And a final one that I've used this particular diet for is gut dysbiosis. You say, what in the world is that? And that's just where your microbiome, all the little bacteria that live inside your gastrointestinal tract, are either out of balance, you've got too many of them growing there, which would be more the SIBO sort of thing, or too many of the wrong kind, or the balance is not right. I've got lots of weeds of a lot of varieties and they're taken over. And we don't want that to be the case. It should be a beautiful garden inside your gut of all the different guys that live there. They benefit you. They're symbiotic. They help you. They generate all sorts of things like vitamins and other things that you need for growth and well-being. But if they have the wrong kind or the wrong amount or in the wrong way, that's very detrimental and it can have excessive harmful bacteria. So that's another reason that I've used effectively the elemental diet. So we'll talk about that some more. So how exactly does the elemental diet work? Again, this is not going to be for everyone. This will only be for those who have severe gastrointestinal tract related conditions that we can't resolve with other means by changing your diet or eliminating things that caused you stomach upset, irritation, inflammation, etc. So the elemental diet replaces all solid food with a nutritionally complete formula. And this is done for several weeks in a row to reset your gut. It allows it to rest, to heal, and rebalance without causing inflammation. Now, the elemental diet, again, you'd say that's a little bit more extreme, certainly so. And it's pre-digested and it's got simple sugars instead of complex carbohydrates, essential fatty acids, vitamins, nutrients, minerals, all that sort of stuff in a formula. Typically, the ones that I use come as a powder, and that powder is kind of like protein powder, if you've ever used that sort of thing, and you just put it in water and mix it up. You receive complete nutrition. It's kind of like getting an IV without getting an IV. So it allows your gut to rebalance. Now, I'll let you know that the elemental diet is not the go-to favorite for anyone that I've used it for, myself included. It's not a tasty treat, and it's not something you're going, this is great, I'll just live on this stuff. Uh, it's it's not delicious, but it is nutritious. But it serves its purpose, and I like to maintain that particular diet where you just have this every day as your food for 2 weeks or so, and then allow a time for the next 2 weeks or so to use it as your food for the majority of your meals. So for example, if you're a breakfast, lunch, and dinner for 2 weeks, I like to use it for those, and all of your calories and all your consumption comes with this product. It's a difficult, challenging 2 weeks, I will tell you that. And then after 2 weeks of doing that, you use it, we'll say, for breakfast and lunch, and try to eat a reasonable, appropriate dinner. And something that's easily digestible, products that you know you don't have difficulty with, not loaded with simple sugars, just those sorts of things, or the complex carbohydrates like we'll say rice and potatoes, etc. Minimal things, a diet that's reasonable, lean meats, and some minimal fruits. Vegetables are okay. It allows that to reset, and then you, after that, have careful, gradual reintroduction of foods so that you don't overwhelm your gastrointestinal tract in the process of going off of this product. So only you can say which one or if either one is right for you. If they don't apply and you don't have gastrointestinal symptoms at all, then perfectly fine, you can pass. But if you fit into this category, there are specific reasons and purposes for each. We'll discuss those. The elimination diet, you can manage that yourself. You can get some guidance. There's lots of things out there that you can read. You can certainly reach out to me. The elemental diet, though, typically requires medical supervision because it is significant and you have to get a specific elemental diet supplement or product. And I can certainly help you with that. Some I find are better than others. But comparing the two, the elimination diet helps you identify food intolerances. It's a minimum of 4 to 6 weeks so that you can get that sorted. Whole, unprocessed foods, except the items that are eliminated, obviously. And you can get this diet for mild to moderate symptoms or to determine what it is exactly that your body's having a reaction to. It requires meal planning and tracking so that you can know what it is that you've consumed that may be giving you symptoms and what's not. The elemental diet, on the other hand, heals and resets your gut. It's a minimum of 2 weeks on that, and then a minimum of 2 weeks after that on partial. That's my recommendation. It's a professional pre-digested formula only. You can't get this yourself. I use it for severe gut conditions, for microbiome overgrowth, dysbiosis, etc. It's highly restrictive, but it is clinically supervised and very effective. So how about some practical tips for success? Well, for the elimination diet, you have to keep a food journal to track your symptoms. It doesn't do you much good to stop these food products and then have no idea whether or not it helped or didn't. So you have to track that and see what's causing your symptoms. And you stick to a whole anti-inflammatory food diet. And then you reintroduce one food at a time to pinpoint which ones trigger your symptoms. For the elemental diet, you have to follow a professional's guidance. Typically, that's a doctor, myself, or a nutritionist, etc. It's a medically supervised diet. So you can contact me for more details, recommendations if you happen to fit into that category. Obviously, you need to stay hydrated. That supports your gut health with proper probiotics if needed afterwards, and reintroducing foods as you transition back to whole foods and gradually to avoid shock to your digestive system as you move from a pre-digested or almost completely digested formula to something that's normal food. I will say with both, I do like to keep your hydration high and also do recommend increasing your fiber so as you do clear abnormal things from your gut, particularly bacteria, fungus, debris, you've got enough fiber to move that through your system. It doesn't get reabsorbed and you wind up with what's called a Herxheimer reaction. Additional symptoms as all of those nasty things can get reabsorbed into your bloodstream. So it does require some supervision, but those are my recommendations. So some final thoughts on both of these. Both the elimination diet and the elemental diet can be very powerful tools for gut healing, for reducing your inflammation, for reducing body-wide or systemic symptoms as a result of reactions or allergic distress to products that you're consuming. But if you suspect food sensitivities or problems with certain foods or food groups, start with the elimination diet. If you have severe gut issues and you're really in a bad way, then the elemental diet may offer the reset that your gut needs for you to make progress. But you need some professional guidance, certainly reach out. Proper implementation, follow the protocols exactly for the best results so that you can find out what is causing the issue and how to go from there. And then you can move to a sustainable strategy if it's certain products that you have problems with, that you know how to eliminate those from your body and improve your overall health. So I hope you found this information helpful, and that would be wonderful. If you need some help, contact me, and I can give you some product recommendations, or if you have further questions. I appreciate your hard work, and getting the support that you need can help you in the process is something that's difficult or different. So here's to your health. I'll see you next time.